Hi, I'm Michael Didner. Today is November 9th, 2020. I had a total knee replacement on my right knee last Tuesday, so it's been 6 days. And I thought I'd share some of the things that, despite YouTube feeding me loads and loads of videos about total knee replacement and physical therapy and post-op preparedness and such, I haven't heard people say. Maybe I've missed it. Maybe my doctor said it and I missed it. But I figured I'd share in case you hadn't heard it. These are not things that are rocket science and you wouldn't figure out on your own, but it might help you be better prepared. And then I really want to talk about the decision of doing both knees at once, bilateral total knee replacement versus one at a time. So to start off, just a little history. My first knee problem started when I was 10. I was at tennis camp. I played tennis all day long, and then I was bored in the evening. So I jogged around the track for 4 miles, and at some point my knee just gave. And then I didn't really think about it much, but I started having knee problems for years and years, and my first real knee surgeries, I was 15. Was going to do both, and this was one of the earliest arthroscopic knee surgeries. I was using Dr. Kim Sloan, who was the doctor for the New York Giants at the time, and I think I was going to do both knee surgeries, but we did the worst one first, and when he got in there, he said it looked a lot worse than he thought it did. There was a bone chip in there. And so I woke up with only one being done and had to go back 6 weeks later, do the other one. And I think that was pushed out because the Giants made the playoffs and he had to travel with the team, so we pushed it out. Since then, I've had 2 more surgeries on my right knee and 4 more on my left. The left knee included an ACL, and also at one point we did a microfracture technique where they draw some marrow and it forms scar tissue, which is somewhat soft, and that improved things for a little while, but it wasn't a real lasting thing. I've done the injection, done a lot of things. Been thinking about doing knee replacements for a long time because I'm an avid tennis player still, and kind of relegated to doubles now. And I thought it was less than this, but apparently 6 years ago I went to my doctor and said I might be ready, but I had some questions, and one of the questions was, will there be any restrictions? And the doctor said no. I said, so you mean I'll be able to run? And he said, well, oh no, you can't run. I was like, oh, what did you think I meant by restrictions? But the real question was, will I be able to play singles? And the answer was, for the most part, no. And at that point, I could be competitive even at a 4-5 level in doubles at that point, so it wasn't going to buy me that much. But over the last several months, usually pain hasn't been my problem. It's just the lack of mobility. But I did get to the point where I spent several weeks where it was hard to even sleep because the knee was painful and there's no way to get a good position. And then it'd go away for a few weeks, and then it'd come back for a week, and then it'd go away. But just became clear it's probably time to do it. And then here comes the bilateral versus one at a time decision. My father had done it, and he got both done at the same time. But that was because his insurance really wanted him to. And I kind of was arguing with my doctor, talked to some other doctors about why don't we just, rip off the Band-Aid, get it done all at once. Just do it once. And everybody's pretty much saying no. And but here's the thing. They didn't explain it to me in a way that really resonated with me. But since my surgery, I've been fed so many videos on YouTube from other people who've done bilateral knees, and some who are doing great, some who are not doing great. And it came to me that here's the real deciding factor, whether you even want to push for it or not. If you do bilateral knee replacement, you will need a level of 24/7 support for at least a week and probably a little more that you just can't get away with. So if you're willing to get that kind of support, if your insurance will pay for you to stay in hospital, or somebody will get you to the toilet, or you're willing to use a bedpan and urinal for a week, then it's something to consider. But thinking through it and everything I've seen now, I'm glad I went ahead and did just the one. I am scheduled to do another one 3 weeks after the original surgery, so in just over 2 weeks. And hopefully that wasn't the doctor just saying, well, we'll say that and then you'll decide you want to push it out. I think there's a good chance I will be ready at that point. So I'm actually looking forward to that and just getting it all done. But I'm really glad I went with one, and that for me was the key factor. So, by the way, there are some other videos, people who've done bilateral knee replacements. I saw one with a woman who was 5-6 days afterwards very distressed. She didn't have a choice because of her job and something, but it was obviously very difficult. Another one, I saw another one. I don't remember his name. Dude was doing great. 6 days after, which is just like me, he was walking after bilateral the same as I am now after a single one, and apparently after 16 days he's walking great. So I have to say a couple things though. Pretty confident that he is a little bit way off the scale on the positive result end, and he was a martial arts instructor, or is a martial arts instructor, and he's probably in fantastic shape. And I think expecting that kind of result is would be really optimistic. So those are the things to factor into your decision. So just a little more history. So this is not my first total joint replacement. I have an artificial hip because I got to the point where, again, it wasn't pain. I just really couldn't move. I had my Achilles tendon completely repaired too. So just in terms of relative pain, the hip was actually probably more painful. It took longer. They cut through more meat. And it takes longer to heal. Quite a bit longer, I think, at least at this point. And the ACL surgery was actually probably more painful. Part of that is an interesting story in which the surgeon put this bulb with medicine going directly into the incision that was supposed to relieve the pain for a few days. And it really didn't. And after 3 days, I took the wrapping off and found out it had fallen out right away, and that's why it didn't help at all. So before I go into the prep things, the last thing to know is that the first day when you're done with your surgery, if you're like me, and I don't have a huge sample set, I just have me, I was astounded at how good it felt. I was able to, without manipulating it with my hands, I was able to bend well over 90 degrees, straighten it as straight as I can tell with all the bandaging on. I was able to walk. I was using a walker, but it was not particularly painful. It was pretty good. Then the next day happens. The stuff they stick in your, the medicine they put in your joint, it dissipates, and it's uncomfortable. And then the third and fourth day are worse. So the second day I actually mostly used Tylenol, trying to avoid oxycodone, because for one thing, I'm going to be doing another surgery like this, and I don't want to have to keep taking it forever. But at the same time, the third day, just even to get some sleep, I needed to do the oxycodone on the fourth day. Then yesterday, I didn't do it quite as much. I took one, I think I took 3 or 4 times during the day and supplemented it with Tylenol at one point. And lots and lots of icing, keeping your leg elevated over your heart. That's all. Everybody will tell you to do that and do as much as you can. I actually have, your sleep schedule is going to be messed up, so I would just wake up in the middle of the night and ice the knee anyway, watch some TV, go back to sleep, wake up, ice the knee again, go back to sleep, and then do that a lot throughout the day. So that kind of brings me to the beginning of the prep things and things I wish I would have known and things that I don't hear anybody else talking about that I wish I knew. So one of them is you're going to be sleeping some weird hours. I mean, when you can sleep. So it's nice wherever you set yourself up, have some earplugs and some blindfolds available. It's likely not going to, unless you got a really good room that you can keep dark, which I do. It's just upstairs, not where I set up myself for after surgery. So I needed to bring earplugs and blinders downstairs for parts of the day. Sometimes I can sleep with the light on, sometimes not. The other thing that I've really never heard anybody say, and maybe it's not an issue for a lot of people, but it's getting cold here at this time of year. I'm in Portland, Oregon, Beaverton, Oregon. And so we tend to use flannel sheets. Don't use flannel sheets. Switch to linen sheets. It is so hard to move your leg with ace bandages and the wrappings and such that I had on when I had flannel sheets. I had to get those changed out. It's huge different to use linen sheets. That's like my one big takeaway that I hadn't heard anywhere else. And maybe last time it just didn't come up with my last surgeries or something. That was a big deal. Another one is, since my hip surgery, which was 9 years ago or so, by the way, best decision I ever made. Total hip resurfacing. But I've had those bars that you put on that you can set up on your toilet so that you can sit up and stand up and sit down. Didn't set myself up downstairs with them. They've been upstairs all along. And after a day, I got those moved downstairs. And I would recommend, unless you want to rely on other people, and even if you do, it's just so much easier. Having said that, I was actually sore for a day from just picking up and putting down, and you might be anyway, just from the work you'll end up doing with your arms. So pre-op, yeah, it's good to get in a lot of good shape. Get your legs in shape, do the knee exercises your physio tells you to do in advance. You might want to work on your arm strength a little bit too. Yeah, lots of ice. And also for the toilet, I mean, some people recommend getting a toilet razor. With the bars, I don't need that. But, if your arm strength isn't there, yeah, having something that raises the toilet seat will be very helpful. And then, actually, the last thing, move your rugs. It's cold out and rainy, and I don't want to go outside to walk, but you're supposed to walk 5 to 10 minutes several times a day, even the first few days. And I've been doing that. A lot of rugs around my house. Got to move them because you don't want to trip yourself, because falling would likely be bad. So hopefully you find this useful. Feel free to like and share it or not. I'm just trying to be helpful for anybody who's about to go through this, or has gone through it, or is trying to make a decision about going through it. I'll likely post a follow-up after the second operation and let you know how my decisions have worked out and how my progress has been. But again, everybody's different. Don't count on any one result. Look at the spectrum of what you can expect and be ready for everything you can be ready for. So I hope you enjoyed this and hope you learned from it. Thanks, and bye.